So, a very beautiful day to you all. We continue from where we stopped yesterday. This is question 69 and we'll stop at question 40. So during this is our first file of surgery 2014 basis. So during a dynamic investigation of a patient, we have in this particular patient increase of central venous pressure together with decrease of arterial pressure. Please take note of this question very well, because in some instances or in internal medicine basis or some booklets, the correct answer they shows was increase of bleeding speed. But however, because of the increase in central venous pressure too, the best answer in this condition is not even this answer chosen in some other instances. The correct answer is development of a cardiac insufficiency. That is the best match to have increase in central venous pressure and a decrease in arterial pressure. You can also have something like this in cardiac tamponade. There will be increase in CVP and blood pressure below. So as far as this one we are considering is this, and if this question should come out in the Krok, I will encourage you to choose the best correct answer, which is developing of cardiac insufficiency. 20-year-old, this traumatology question, 20-year-old patient was admitted to trauma center. Majorly, there is pain in the left ankle joint, and found out that clinical examination found out that the patient had closed fracture of medial malleolus without displacement. So already this is like you are looking at the fracture of the medial malleolus, and if you are going to fix this patient, you want to adjoin the two ends together. So this looking at it just logically, the best answer is going to place it at a right angle with varus positioning of the foot, right angle with varus positioning of the foot. This is what is going to cause a decrease in the angle between that joint so that they can be fixed together. So when you have a patient with acute urinary retention, together with the fact that the patient had been on also catheter, have been use of metallic catheter on the pre-admission stage, and there are purulent discharges from the urethra, the best thing to do is to go another way to try to drain the urine from the bladder of this patient, and that will be specifically by doing a suprapubic cystostomy. And the answer that corresponds to suprapubic cystostomy in this case is this open epicystostomy. Is the same thing, open epicystostomy. All this, it has nothing. This is not about the prostate. We are talking just about the acute urinary retention here, not about the prostate hyperplasia. So it's none of these answers. And introduction of a permanent you won't want to do that knowing that the patient is discharging purulent stuff from the urethra in acute urinary retention. Okay, which kind of tumor, which kind of cancerous growth do we have at the level of costovertebral angle? In fact, irrespective of the age of the child. So we're having it at the costovertebral angle, and I'm sure right now you are thinking that what we have there is the ganglion. We have the dorsal nerve root ganglion. We have the ganglion there. So let's just take the answer to very simple as this is a ganglioneuroma. All right, they are telling us about a 4-year-old child in the kindergarten. You say complaints of poor appetite, fatigue. I'm sure maybe it may sound familiar to some persons by their experience. Skin and mucous membrane are pale, but the most important thing is that the leukoid reaction is of eosinophil type. Which of these conditions, together with these symptoms, will cause eosinophilia? It's Emmets infection. That's when you have this Emmets infection. All right. They are telling us anytime they give you a question like this with little application in real life, the first thing to do to know the amount of blood that is lost is by calculating your shock index. Norm of shock index is around 0.5, so that will help you to remember that it is usually the pulse pressure divided by the systolic blood pressure. So that will be 140 divided by 60, which will give us about 2.33. Now after you have gotten your systolic index, you will then there's actually a table you can just take note of this. When the shock index is greater than 1, just up to 1, when it is up to 1, it means that the patient has lost about 20% of the circulating blood volume. From a ratio of 1.1 to 1.7, when you have 1.1 to 1.7 as your shock index, the patient has lost blood volume of about 20 to 40% of circulating blood. But if it is less than 1.8 or more, or 1.8 or more rather, you're having over 40%. However, but the only option that is reaching 40% in this case is 30 to 40%. So don't forget, calculate your shock index first of all. Pulse pressure over systolic. Whatever you get, you match it to what I just told you. You can just check it online also, like you see a special table, or try to just take a little note from what I just said. Alright. We're having a 19-year-old girl admitted to the emergency department unconscious. This is cyanosis, this superficial breathing per minute. Okay, it's not so. This is a little bit low. Blood pressure is 90 to 60. Patient going into shock, normal. What action is necessary in this situation? First of all, I'm sure that in this particular situation, you are thinking that the fact that the patient is going to need like support on respiration, but according to that, so we are going to choose here a controlled respiration. A controlled respiration is just a means of supplying adequate amount of oxygenation to the room, to the environment of the person. So it's different from oxygen inhalation directly. Which of these preparations are antifungal? So when you see a question like this and asking which of these drugs belong to this group, any option that you find a particular drug that you know that does not belong to that group automatically negates that answer. So that will help in case they change the drugs. But here we have fluconazole, Orungal, and Nisoran. All these are antifungal drugs. They use this very well in gynecology and so on. Why these are ACE inhibitors, antitubercular drugs, these are antineoplastic drugs, anti-cancer drugs. Also, at least this is an anti-cancer drug. So what develops most often after accidental intake of hydrochloric acid? So let's just look at this question as a acid ingestion, or commonly treated as the so-called, like they call them the caustic ingestions. When you have acid ingestion, usually there is tissue damage by coagulative necrosis. And so this is going to cause some coagulation in the system together with metabolic acidosis. And that coagulation, that initial part of it that we just said right now, is what can lead to development of cardiac insufficiency. However, if we have maybe like corrosive ulcers, we have stomach affection in the option, those will actually take the first place. But we don't have it here, so cardiac insufficiency. Reading through this question of a patient with trauma and everything, they asking us, which form of Panaris is this? So look at it, they are telling us that we have osteomyelitis of the 5th finger. Already this is directly, they are talking about the bone. It's not any of this anymore. It said osteomyelitis, that's the bone being affected. So it's simple, according to the question, bony. I've encouraged us in the real exam, don't think too far. The further you think, sometimes the greater the chance that you will reason out the right answer, reason it away. So don't think too far. Right-sided pneumothorax, we've talked about it several times, is surgical drainage of the pleural cavity. Alright, we have a patient presenting with, so they said a painful 8 centimeter knot above the medial malleus. This emergency presentation. Examination in the standing position demonstrated a distended vein above and below the mass. There are no other abnormalities on physical examination. What's the most likely diagnosis? I'm sure you are thinking basically of maybe venous thrombosis. You're thinking of something affecting the vein. And so we have early deep vein thrombosis and superficial vein thrombosis. However, this manifestation is more typical for superficial venous thrombosis. If it is deep vein thrombosis, the first and most clinical presentation are either of two things. One is edema. Even before pain, you may have pain and everything, but it's edema, and that's not what we are really talking about here. And the second is a patient with deep vein thrombosis might simply just come up with the presentation of pulmonary embolism. So when you see this distal vein above and below, choose superficial venous thrombosis. ENT question reading through, they are telling us that otoscopically there is eardrum protection. I'm sure right now you are thinking of something that has to do with otitis media, hyperemia and swelling of lung. This is otitis media, and they said it developed 3 days ago. So again, don't let us reason the right answer away. This is acute prevalent otitis media, and you see high temperature. All right, this is a patient with tonsillitis, acute throat pain, only on 3 days. So we have tonsillar hyperemia, enlargement of edema. Tonsils are covered by round yellow fibrous patches around crypts opening. Beta hemolytic streptococcus in swab analysis. What is the diagnosis? So already this azura infectious mononucleosis, they be telling us about hepatosplenomegaly, pharyngeal candidosis. We already have beta hemolytic streptococcus and the patch should be different. Pharyngeal diphtheria, they'll be telling us about something that is difficult to remove. So we have acute membranous tonsillitis and acute follicular tonsillitis. So which one is the right answer? If it is follicular tonsillitis, the focus is going to be on the crypt. So acute membranous tonsillitis is just like a stage after follicular tonsillitis, where you have the spread of this fibrous process away from the crypt, or to begin to cover the old tonsils. And if you describe from this question very well, there's covering of the old tonsils. So this is acute membranous tonsillitis. If they are telling a patient with abdominal typhus, irrespective of everything I said, and then finally they are telling us that there's melena, this is we're having already, it means that you know that if you have blood in the feces like this, so definitely you are thinking of there's bleeding somewhere in the intestinal tract, and this is the only thing that speaks of that. All right. 45-year-old woman, mother of 4 children. We said before, when you have a woman that is over the age of 40 and she's fertile, that is, have 4 children and so on, you are thinking of the disease of the gallbladder even before considering the question. And now we have right upper quadrant pain and so on. So this is the only gallbladder situation here, acute cholecystitis. In some other question, the answer may also be cholelithiasis. Anyway, during an operation of presumed appendicitis, the appendix was found to be normal. Terminal ileum is evidently thickened and feels rubbery. Serosa is covered with grayish. The reason why they are giving us all this, but starting with the word appendicitis, the appendix was found to be normal, is that it might have been complication from appendicitis towards the ileum, but they are telling us that the appendix is normal. So we are thinking of right now what can actually be affecting the terminal ileum. So the most likely, according to this description, is Crohn's disease of the terminal ileum. Crohn's disease of the terminal ileum. They said several loops of apparent normal smell tests that are adherent to it, that will help a little bit to differentiate from others. 15-year-old with a 2-year history of mild diffuse tender thyroid enlargement complains of 10-pound weight gain and fatigue. When they are telling about weight gain in a thyroid disorder, a patient with thyroid disorder and fatigue, you are already thinking that that condition is causing hypothyroidism. So what is the most probable diagnosis? If it is suppurative, they'll be telling us about temperature and so on. Papillary thyroid carcinoma, no, this is not condition of carcinoma. They say mild diffuse tender enlargement. They'll tell us about also other things like lymph node and so on. In radius thyroiditis, there's fibrosis of the thyroid gland, but it does not only affect the thyroid gland, it affects many other organs. Subacute thyroiditis, there'll be history of a viral infection in the patient. So, and in subarachnoid thyroiditis, you have initially hyperthyroidism and later you can have hypothyroidism. So, the best answer here is Hashimoto's thyroiditis, where there is another name is chronic lymphatic thyroiditis. Autoantibodies are produced against the thyroid gland and it begins to destroy it, resulting in its primary hypothyroidism, which is the cause of this. You see, Krok, they like zinc a lot. So all these things, alopecia, perioral dermatitis, and so this is zinc. 80 of us hospitalized to the surgical unit, vomiting and acute abdominal pain, irradiating to the spine. I'm sure that this is like the bed-like kind of pain we used to hear about, and that is typical of pancreatitis. So, and in pancreatitis is when you have this hemorrhagic fluid when you do laparocentesis. So this is acute pancreatitis. All right. You see these manifestations in this patient that is having recurrent fractures and everything, they have similar presentation in some of these cases. But let's take note of what is vital in this particular question. It is the deformity of the bones. Deformity. Anyway, we also have hyperostosis, like thickening along the bone axis and so on. But we have deformity. Which one of these conditions? You see, in marble disease, you have fibrosis, you have thickening of the bones, but it's not usually so associated with bony deformity. It is in Paget's disease of bone. That you can possibly still have this normal serum calcium, yet the bone, we're having multiple fractures. What happens is that the bones get softened, they break, then they remodel, and in the process of remodeling they form abnormal shapes. So that's typical of Paget's disease. Bone is breaking down, they are trying to form again. In the process of forming again, they become deformed. So that's Paget's disease. This is not chronic osteomyelitis. They tell you about infection. In multiple myeloma, they tell you about benzoyl proteins. Hyperthyroid dystrophy, they will tell you about abnormal levels of calcium, and that's all. See, all these beautiful stories, when we see it in the exam and you see the option, the last question is, what disease should a doctor consider first of all? In fact, a friend advised that when you see long questions like this, it's good you read the last question first so that you can know what is expected, then you start reading the question. So what disease should be a doctor consider? Sometimes you be treatment, when you finish reading, you think they're asking for diagnosis. So what disease should a doctor consider first? Notice, together with the temperature and everything, that the patient is suffering from diabetes mellitus. When you see diabetes mellitus and they're asking for a surgical whatever, you will not be wrong 99% of the time to choose a carbuncle. All right. 19-year-old patient had knife trauma to the left chest. That's intentional, is to point our attention to the heart. And the heart rate is 96, blood pressure of 80/60. Assuming this is not going to the heart, you might be thinking of valvular pneumothorax, but this is not about pneumothorax, this is about the heart. You see, you have dilated neck veins, sharply depleted. So this is pointing out that the heart is swimming in its own fluid. So, and this is typical for pericardial tamponade. It can be a result of penetrative injuries of trauma. In pericardial tamponade, you have shock and you will have dilated neck veins. Alright, this a 35-year-old patient complains of difficulty in swallowing and so on. But this patient actually ingested chemical burns, again in the so-called caustic injections. Chemical burn of esophagus 1 month ago. What complication does the patient have? Again, this is just corrosive esophagitis. This is from chemicals, so nothing else. We have a patient that has been suffering from pneumonia, showed triangle shadow in right lung, and which is towards the lung root. He has been smoking. If they tell that a old person has been smoking, most of the time they started smoking long time ago. So it showed deviation of the outer mediastinum towards the lesion. So what is most? The answer is essential lung cancer. towards the lung growth. However, in some instances you have similar description and the answer is peripheral lung cancer, but in such instances I've also noticed that central lung cancer is not in the option. Okay, here we have sepsis. Doctors suspected sepsis. We can look at all the cases, but when there's suspicion of sepsis and they're asking that what will you do to confirm the diagnosis, the best thing to do to confirm the diagnosis in this patient is just to do a blood culture to isolate the pathogen from the blood. In sepsis, you already have the pathogens in the blood. See, when a patient is having calculus, you can do any of these lithotripsy, depending on what indications to it. But they are telling us together with admission of pus in the urine. This kind of patient with calculus is going to need a surgery. Alright, emergency department of a patient who was lying down the street in the winter. And you know one thing is that when people get drunk lying in winter, I don't know, alcohol is such and a very powerful anesthetic agent. And so they lie down in winter, their body is dying but they are not aware. And they are telling that the temperature of the patient is 35 degrees. Hypothermia is a condition whereby the body is losing more heat than it's producing, and usually it's diagnosed when the temperature is 35 degrees or less. And this is typically what we have here. If it is frostbite of trunk and extremities, the focus of the question is going to be on the extremities. So but here we're having the heart rate, low blood pressure decreasing. This is just hypothermia. Of course, when they come, they won't tell you they were drunk. They might just tell you something happened to them and just look for one story that doesn't match. 48-year-old patient got a job-related injury to the hypodermic varicose vein that is accompanied by intensive phleborrhagia. Choose the optimum variant of first aid. In this particular patient, you see, the correct answer is pressure bandage and limb strapping. You can take a look at some of the pictures. They use it so much in varicose veins. If it is, you see, in all these cases, this is not arterial bleeding, it's a venous, so it's not these ones. The only answer that could possibly confuse a little is Esmer's tourniquet beneath the injury. Esmer's tourniquet is actually used to exsanguinate or remove blood from veins in patients that have the arterial supply cut off also from that same region. So it's not that. Okay, our last question for this particular video, and I hope you are really preparing for the exams. 24-year-old patient got a puncture injury below the Popper's ligament. Popper's ligament is the inguinal ligament, so they call it the inguinal ligament of Popper. Accompanied by intense arterial bleeding. The best method to temporarily stop the bleeding in the patient is going to be the use of a compression band. They are asking us for temporary stop of the bleeding, not a stop, temporary. So the best thing to use there is a compression band. In some instances, when somebody is bleeding at the point, that's why you see some people remove their clothes and try to tie. They are trying to use the mechanism of a compression band. So, have a beautiful day.